Maintaining proper staffing levels in our hospitals is one of our biggest areas of focus, and employee and nurse retention are two of our most important goals every year. But the COVID pandemic has turned this persistent yet manageable challenge into a medical emergency overnight. Our leaders have responded quickly and thoroughly, implementing a number of programs that have brought in hundreds of new nurses and other healthcare workers. Even though we've seen success with these efforts, the need for healthcare workers, particularly nurses, is so great that we must continue to find ways to bring in team members to help our clinical staff who've been stretched to the limit during this past year, particularly right now as our volumes continue to climb. Therefore, I've asked the two people who are leading our recruitment efforts to talk with me today about all the ways they're responding to this urgent need. They know how hard you work and how important it is to get the support you need because they once stood in your shoes. They're both proud registered nurses who've dedicated their careers to advancing their profession, both within and outside of Baptist. So please join me today in welcoming our Vice President and Chief Human Resources Officer, Nancy Averwater, and our Vice President and Chief Nurse Executive, Susan Ferguson. So welcome, ladies. Susan, let me start with you. Can you tell us about some of the innovative staffing programs we've implemented in response to COVID?
Thank you, Mr. Little. I'm very excited to talk to you a little bit today about our liaison team, which is our RN Extender program. We developed this program to provide more support at the bedside. As we experienced different challenges while working through this pandemic, we realized that our current care delivery model needed to be enhanced. The team from corporate HR and from the system nursing team worked diligently to develop this RN Extender program. And currently our CEOs and CNOs are reviewing the program to determine what makes the most sense in their hospital. The bedside RN will continue to be the coordinator of care for our patients, working with these extenders to enhance that care at the bedside. Just one example is to bring the LPNs back at the bedside to acute care where we don't currently have LPNs. They'll be working with the registered nurses to communicate and collaborate as they're providing that care at the bedside. We've also developed a brand new role that we're excited about, and we're calling that the patient care tech role, to work alongside that bedside RN and providing such skills such as taking vital signs, doing blood glucose monitoring, and phlebotomy, just to name a few of the skills. We've also enhanced the role of our paramedics and our advanced EMTs in the emergency department. We've enhanced the role of our patient care assistants and our pharmacists in all of our clinical areas. I want to just take a moment to thank all of the caregivers across the system for all that you're doing each day to care for our patients. Thank you for being a team member with us here at Baptist. Thank you for sticking with us through this pandemic. You're making a positive difference for our patients and their families. It takes a team to provide care in a hospital, and if you're not touching a patient, you're touching and supporting someone who is touching a patient. So in this sense, I consider every one of us a caregiver, and we need all of you at this time and when the pandemic ends.
Amen. I think that's well said, Susan. I appreciate those thoughts. And Nancy, you spend a lot of time studying this and looking at the data. Tell me why all this is going to work and why it's our best approach.
Oh, yes. And Mr. Little, I've heard you say many times that healthcare is a team sport. Susan just alluded to that. And we all know that there is certainly no I in team, which has become even more apparent because obviously when the pandemic hit back in the spring, we had to all come together as one Baptist. So our clinical teams are truly remarkable, and I'm so proud to work for an organization that realizes that it takes all of us to provide exceptional care. So this model that Susan described is a natural extension of the model that we already have in place. But I do think it will distinguish us as being even more compassionate and empathetic to the needs of our patients because the nurses will have additional resources to provide that great care.
Yeah, thanks, Nancy. I completely agree with you. Susan, you talked about a lot of things there, but any other things that you would want to mention about what else we're doing to recruit nurses and other healthcare professionals?
Yes, I'd be happy to. We've got programs in place that recognize our own Baptist team members, like the referral bonus, and we're honored to be able to do that. We've also reached out to our community to see if there are caregivers that live nearby that want to come on board and become a Baptist team member. We've recently implemented a sign-on bonus to attract new caregivers to Baptist. And in a few cases, we've reached outside of our community to fill some of the needs. But our goal through all of these initiatives has been to make sure that we are supporting our frontline staff so that they have all that they need to provide care for our patients.
Thanks, Susan. Nancy, our team members who aren't nurses may be wondering, what else we've implemented or what else we're doing to recruit other clinical team members. Can you speak to that?
Oh, sure. I would love to. Since the start of the pandemic, we've actually hired over 1,300 nurses, but we've also hired over 4,000 individuals that serve in a variety of clinical roles, other clinical roles, and very important support positions. So just like our clinicians who have re-engineered the care at the bedside, our recruiters have re-engineered how we attract talent to the organization. We've hosted close to 15 virtual school and college recruitment fairs as one example, and they've been very successful. We also have launched targeted social media ads through Facebook and Google and other means of electronic recruitment. And, Susan mentioned, the referral bonus, and I think it's very important for us to be reminded of that because recruiting is everyone's job. We have a wonderful referral bonus program that I think folks forget about because it may not be top of mind, but please refer a friend or another healthcare hero into one of the approved categories, which are a little bit different at each entity, but we've hired 35 new team members into this program this year, and we were able to award the person that referred them and also the new person coming on board. So please talk to your HR director to find out more information about what's available, at your entity.
I just want to say thank you to you two for your leadership this year. I'm grateful for what you've done to help our teams be successful. I was proud. We've had the highest team member engagement survey scores this year that we've ever had in the midst of a pandemic. And, other people out there who are watching this today, I know you've heard me say many times, one of my big goals this year in the face of a pandemic was to keep the band together. And so we're doing everything we possibly can to do that. We were excited to be able to offer the COVID Appreciation Award back in the fall, and then the premium insurance holiday in December. And what I want you to know, everybody that's watching this video, there's going to be some other big announcements coming to you next week that we look forward to sharing on other things, other steps that we're doing to not only reward your efforts, but to continue to put our tremendous Baptist team with our combined efforts here to take care of our patients to get through this pandemic. I think we've got another few really important weeks to get through while this vaccine begins to take hold. And I am certainly proud to be going through that journey with each one of you. So Nancy and Susan, thank you so much for talking with us. And you can certainly, those that are watching can find more information about our recruitment programs below. But I look forward to talking to you again next week.
Thank you.
Thank you.